Good morning, everyone. Welcome to another episode of Everything Digital Health. I've got with me Ade Byrne, who is for 20 years was the CIO of Southampton General Hospital and was also the founding chair of the National CIO Network. And he's going to join me to discuss yesterday's fairly out of the blue announcement by Prime Minister Keir Starmer that NHS England, the commissioning body for it for England, is to be abolished. Weirdly, this came only a few days after it was announced that NHS England would be reduced by 50%. So some interesting stuff to discuss there. And what we'll do is gradually work our way through the sort of issues that raises for digital health. Morning, Ade, and thanks for joining me at short notice.
Morning, Mark.
If you want to, I suppose I'd like to just start really by two clarification points or two things that are important to say. I think one, I'm not sure in any of the coverage that I saw yesterday that it was made quite clear enough that NHS England is not the NHS being abolished. But I remember reading the BBC News coverage and thinking, if I didn't know what NHS England was, I would think that the NHS has been abolished for England. Or I certainly might be concerned that that was the case. So I think we should clarify that NHS England is just like a bureaucracy agency, a purchasing organisation that's in the chain between the Department of Health and doing real things. So the absence of NHS England, while it will be disruptive during the process of it going, it shouldn't really change frontline NHS delivery of care. So like somebody who was receiving care should carry on receiving exactly the same care. And the other thing I kind of wanted to say was just that my sympathy is extended out to all the people in ICBs and NHS England who are going through all this, that it's a huge amount of uncertainty to be thrown into without any proper consultation or any sort of planning. It's just there's just going to be all this change and there's nothing you can do about it, kind of thing. So with that all said, I think we can sort of kick off really, and I wonder if you had any sort of opening thoughts about the announcement.
Yeah, what you said there really. I'm sure everyone's a member of various messaging groups, WhatsApps, and others, including the Discourse platform, and all of the message groups that I'm a member of sort of lit up over the last couple of days, really, people talking about this. And some of those, on a personal level, someone asked, oh, are they, getting rid of the NHS in England then? So right from, completely getting rid of the NHS through to NHS England as being sort of renamed and moved across into the Department of Health and Social Security or something. And of course, it's neither of those things. But regardless of all other things that, you call these various organisations that exist and have existed over many years, I think we'll go over the history a little bit of how we got to where we are today. But things change names and don't really seem to change too much in terms of the delivery, do they? And I'm not saying that nothing will change, but the fact is that NHS England delivers, all of the kind of devolution of the budgets in the NHS. It pays for the care, it commissions the activity, it does the planning, it looks after the data analysis, it looks after the governance around all of that. As far never mind, and those are just kind of the digital things it does, and you've got to think a bit wider than digital. We're on a digital episode, obviously. So a massive amount of work that does need doing, and of course, we've all sort of done face palm occasionally at some of the things that we see going on in what we colloquially call, the centre. But they do some essential work that cannot be not done. So yeah, that isn't going anywhere. I think we will see a lot of disruption for the staff, and that is, you've already recognised that some people are going to go through a hard time during this, like with any reorganisation. It is a reorganisation and not a complete abolishment, but reorganisations are difficult for the people in it. And I think, we'll probably come back to what the impact of this is going to be, but there's undoubtedly, whenever a reorganisation is going on, firstly, the people involved in it are quite concerned about their personal situation. And secondly, that impacts on their ability to do things and deliver the strategies and programs and plans, etc., that they're doing in their day job. So
I can imagine that the productivity now in NHS England and ICBs, like right now today, must be really low, just because everybody is reeling from the news. And
well, if you were them, you'd be spending half your day on LinkedIn, wouldn't you?
Yes, exactly. You'll be on NHS jobs, or you'll be phoning friends, or
Yeah.
and that's fair enough. As in, they're providing essentially sort of peer support for each other as well, because it's a big thing. And whereas if this had been planned, in the same way as when NHS England came into being, that came from a white paper that was then made into law. And this was all whilst I was finishing my GP training. And I remember that period that there was lots of consultation. There was the idea that a new body would come into being. It happened over months and years, so people could plan for it, and they knew that they would perhaps their job in what was the Department of Health would move into NHS England. But that happened over months, and they could see where they were going. Whereas I think a sort of shock announcement by the PM on a Thursday afternoon suddenly throws everybody into disarray, because it's like, well, is my job going to be devolved into an ICB? Is my job going to disappear? Is my job going to be part of the Department of Health? Is my job going to be, I don't know, absorbed into Foundry and Palantir? I mean, there's so many potential concerns.
Well, I mean, it's I know this is not a political discussion, but if you think back over the last 12 months or something, the government has done a number of things that, I personally have agreed with. It's done some things I haven't agreed with, but it's done communications really badly. And, some of the things I've agreed with, when I first heard them, I thought, oh, what the heck, because it's been announced so badly. And this seems to have fallen between two stools, really. What you've said, which is a planning exercise where people know where they're going, which in the public sector takes too long. Undoubtedly, it means that people are under stress for a long time. And if you compare with, we've all got friends who work in the private sector, and some of those have gone through reorganisation, and that happens overnight. Bang, you're gone. Clear your desk. You're off. Now, that's a huge shock, but at least it's done and you move on. Here we are. We had an announcement about cuts in ICBs and everyone cutting their budget, and then within 24 hours, that had completely changed to NHS England gone. And I mean, talk about strategic whiplash. I mean, the people who are involved in this must be like just in a headspin or something.
I really wanted to talk about that. That the last week has had an announcement about NHS England to be cut by 50%, which doesn't abolish it, but obviously causes great pain for the people there. And then just a few days later, an announcement that 50% cut is also essentially going to be passed on to the ICBs. So the ICBs also woke up to news yesterday morning, I think it was, that it had been leaked to the HSJ that there was going to be this 50% cut in ICBs. But then within a few hours, that was eclipsed by a totally different approach, which is get rid of NHS England. And it just implies that there's either some difference of opinion or active disagreement, or a lack of a clear plan at the very top, so at cabinet ministerial level, as to what to do. And I'm not sure what to think, really. if I'm
Feels like
gonna
we've
sort of,
caught an infection from across the pond, doesn't it? You know,
it
where
does,
where
yeah,
things, just kind of get done on the hoof. And, if you think back to back in the day when we used to watch, Yes Minister, you're probably too young to have watched Yes Minister, but the civil servants were really boring. Things happened over a cycle, and politicians get frustrated with civil servants. We all know that, but they do steady the ship. And I think that what we're seeing now is something that feels a bit more reactionary.
yeah, you can't help but draw the parallels between this and Doge sort of slashing and burning through stuff with a chainsaw. And maybe there is some kind of attempt within the government to curry favor with the other side of the Atlantic by suggesting
Well,
we're
that and
doing similar things.
maybe it's frustration is coming out in this way. The frustration that over many years they haven't really been able to make the changes that they wanted to make uh, in government, and we all know they get um, sort of frustrated and getting bogged down with those kind of things, don't we? So
Mm,
maybe that's coming out. And we've gone through a number of different sort of organizational changes, and of course the pandemic is one that sort of caused a lot to be uprooted in the NHS, and sort of things were thrown up in the air and landed again, like we're seeing these days. It seems
yeah.
that's the way policy is defined. But um,
Some good stuff
things
happened
were,
during the pandemic very quickly, and I remember people saying at the time, "We need to keep this level of velocity and the rate of change and the possibilities that came out of that." That said, although we had great fast-moving stuff, I think it didn't take long for certain corporate entities to catch on to the fact that the rules are being relaxed, and we saw lots of corruption, with PPE scandals, um, various
yeah,
uh,
not just that. I mean, I was
implementation.
in it, and you were in it as well. But from a position of a budget holder at that time, all bets were off. Anything you asked for, you got. Really, you didn't. You could, whereas a few months previous, you'd have to write a 5 case model to release 50K or something. Not
Yeah,
quite, but all of a sudden you could write half a page of A4 um, to
and get it
release, a
approved.
couple of million quid.
Yeah,
And I think, to be honest, I have to admit, when I was watching people clapping on the doorstep on Thursday night or whenever it was,
yeah.
at that point in time, I was thinking, this is going to come back and bite you lot, or us lot, because this will not last. You remember everyone saying, "Oh, the world's changed. We're not going to travel as much as we used to. We really like this quiet life and no cars on the roads and stuff." And of course, within 12 months, there were more airplanes flying around than had ever flown around before, weren't there? Well,
Yeah.
you know, the
So it
NHS
didn't
put in things in at that time. It was massively patting itself on the back because it rolled out free version of Microsoft Teams. Well, we all knew that wasn't free.
no,
It was never going to
that
be
was a
free.
it
It was a
was always gonna
classic,
be a drug
because
dealer
it was,
business
yeah,
model. So it's like
exactly.
you can have it for free now.
Mm,
Yeah, many companies did the same sort of thing. Some big bad ones and some small SME
yeah.
type things.
It's a
QRX
terrible
made
piece of
enormous
software.
strides during that period.
Terrible piece of
Um,
software that we're now stuck with, basically. You know.
Teams, I mean,
Yeah, yeah,
yeah,
awful.
yeah.
I mean, if I don't know if you, I mean, I know you're open source, sort of trying to use open source software wherever you can. So, but if you're stuck in that position where you're using Teams all day, go and have a look at the resources on your PC and see how much of that it's using. You know,
Well, I only
just
ever
just to do nothing.
I'm on Linux and have been for 10 years, and Teams works brilliantly in a browser tab, and it's sandboxed in there, so it can't take over my entire computer. I want
And
to just change the subject a little bit. Let's have a couple of minutes just talking about the origins of NHS England, how we got here. So, um, NHS England was born out of the Health and Social Care Act 2012, which was put through Parliament by the then Health Secretary Andrew Lansley, Conservative Health Secretary. Um, and that resulted in the creation of what was originally called the NHS Commissioning Board for England or something like that. And then that got renamed to NHS England to be in line with, Sport England and all the other things. And the idea around that time was that clinical commissioning groups would do all the local commissioning, and it would be devolved out to GPs, and that GPs would form little clusters, and that they would do a lot of the commissioning for themselves, kind of thing. And I remember my GP trainer at the time said, "Be very careful with this, Marcus. It's a poison chalice." Handing out what appears to be the keys to the kingdom, saying you're going to do the commissioning now as GPs, could backfire very easily and essentially make it so that when mistakes happen or when things are underprovided or whatever, it'll be the GP's fault. Which there's already enough stuff in the NHS that appears to be the GP's fault, or that certainly people complain to their GP because that's the only person they can complain to. And he just felt that this was going to give license to those people, give even more things that were now our fault. But actually, over the past decade and a bit since then, all of that GP commissioning boiled away anyway. So we had further reorganisations. We've had at least two. We had strategic health authorities, and they were big chunks of the country, weren't they? And then we've had ICBs, and they're a bit smaller.
Yeah, ICSs and now ICBs. Yeah.
I mean, I've lost track because I started in the NHS in 2000, but I was training from 1995, and back then we had GP fund holding, PCTs, PCGs, CCGs. There was CC something else. We've had NHS England commissioning body, then NHS England, NHS Digital, NHSX, NHS Improvement, Health Education England. It just blows your mind, doesn't it? And it feels as though we've been on a 15-year journey to make all these organisations that do arguably vital things, but then they've bloated into their own sort of blockers. So they're there to do a thing, but they actually end up stopping that thing happening more than they enable it. And now we're in the situation where almost all of them have got rid of, and we're back to just Department of Health.
Yeah. I mean, I know you're planning to do a chat with Joe McDonald, who refers to the lava lamp theory of the NHS and how things come around. And it is like that, really. And in the acute space that I've mostly worked in, almost exclusively worked in, those changes have just manifested themselves in slightly different ways. The hospitals used to be run almost by an administrative function outside as a part of the local health authority, and then they became trusts, and then over time you had to become a foundation trust, and that gave you more financial independence. I mean, when you were an ordinary old trust a few years ago, you couldn't even keep 1 penny in the bank overnight. You just had no control over money at all. All the money was managed ultimately by the Treasury. Obviously, there's a lot of money in the NHS, and that used to be invested, and they got the best rates and things. So they didn't keep any money in individual organisations. So largely, it was about managing the money, and then, as you say, commissioning. Who commissions? Of course, before the CCGs came along in 2012, the PCTs were already commissioning. So really, you could argue that the PCTs were too small as entities to do that job effectively. And I was part of that. And you could see, what's the point in a PCT? I don't know, buying half a dozen spine operations in a year or something. It feels absurd. And all of the kind of activity that has to go on to set that contract up. And there were so many deals in place. It was like car trading or something. I mean, we in the information team, the data warehouse, the set of rules that we had in place to manage those contracts and discounts and volume discounts and everything. It was like arcane, as a process.
Yeah,
So
and
yeah, and like you
lots of
say,
this
we've gone
commissioning
through
stuff.
that. PCTs disappear. The CCGs were much bigger and therefore had more a kind of a critical mass about them. And then, of course, NHS England owned specialist commissioning. Um, and I'm not really sure what all the reasons for that are, but you can see why specialist work requires its own kind of fund. Some of it is extremely expensive. Some of it is only done, you know, on very rare occasions. Maybe
Yeah,
they wanted to centralize more of that work. I don't know. They dropped the ball a little bit when they took the budget over. I do know that they. They used to under commission for all activity in the PCTs, and then worry about it at the end of the year when they'd run out of money. And when they took the specialist commissioning on at NHS England, they only took the budget, the amount that was budgeted for that work, and therefore they had an immediate black hole in their
oh god,
funding.
I
So that
mean,
was
this
quite.
stuff is the kind of stuff that I find like mind bending, and it's not my area really. Budgeting and commissioning and that sort of thing. Um, I the big worry I have about the change we've seen this week is that just like all the other lava lamp reorganisations, in the immediate aftermath of the announcement, nothing can happen. So all work is on hold, decisions get deferred and deferred, and so you end up entering a sort of what can be a couple of years of like nothing happens. We had this right in the middle of whilst I was the chair of the RCGP Health Informatics Group during COVID. It wasn't long after NHSX had been created, and we'd already had a huge amount of confusion and turmoil when NHSX came along, because quite a few people in NHS Digital were sort of pulled into NHSX, and same from NHS England. It was a new blob in the lava lamp. During that period, you couldn't get anybody in a meeting to say anything of any meaning whatsoever. There would be waffle, there would be prevarication, there would be, I'll go back and ask the team, but nothing happened. And the same happened then only a few years later when they got rid of NHSX and we all went back to what we had before. And we we went into a period where nothing happened for a while. And we don't we don't need that right now, to have a 2 to 3 year period of nobody making a decision while they fold NHSE into DHSC.
Yeah, I'm kind of one of probably maybe only a few people that kind of supported the thoughts and what was going on with NHSX really, um, because it felt like actually NHS England as they were at the time were not really managing a digital strategy very well. They didn't have it at the forefront of their thinking, if you like, whereas NHSX was an organisation that absolutely
Yeah.
did, and then on top of that, they set some really good strategic objectives around owning intellectual property,
Oh yeah, they
using
had an
more
open source
open
policy.
source. Yeah, and they wanted to use truly modern technology and not kind of get stuck in some of the kind of
Yeah, I was pro
old products
NHSX
we see.
because of that, because I think that it was born of the need for a culture change, and
Mm,
whoever decided to create it, I think it happened under Matt Hancock's watch, but I think he was
mm,
advised by some good people around
mm,
him, that there needed to be a new body, because I think there was an acceptance that you can't change NHS England. So the solution was create a new body, put new ideas people in there with new culture, much more agile, much less waterfall, much more about demonstrating small iterative benefits, and then let's see where we get to with that. And they were on the right track, but they just didn't really have enough runway before they got abolished themselves.
I think so. Yeah, it's a shame. I mean, working with Ade Byrne, at the time, it was a kind of a breath of fresh air, really. Someone with some vision that was outside of the more traditional NHS way of looking at things, shall we say?
Absolutely.
Yeah.
Yeah, yeah. So we've talked a little bit about the lava lamps and the downside of all this sort of thing, but what are the potential upsides of not having NHS England there? And we're going to have a bit of confusion, and then everything will be either in an ICB or it'll be in the Department of Health and Social Care. So how could that look for digital health as it starts to improve?
Yeah, it's probably a glib statement, really, but through any kind of radical change that's going on, there's an opportunity for people, who've got a bit more an entrepreneurial spirit about them or something. There will be opportunities that are created through change, won't there? So, and you can't always see what those are yet. And actually, the times when the country generally is more innovative are when their backs are to the wall and they've got, no
Yeah.
money,
Well, I think it's
and
referred to
they're forced to
commonly as
do
the sort of
things.
Dunkirk spirit, isn't it?
Well, it kind of is. I wouldn't want to go there, but the Blitz spirit and that
Yeah.
kind of stuff.
Okay.
We're
Yeah.
we're largely where we are today, as a country because of people who hang on to those kind of illusions or
Yeah.
delusions. But
Indeed. Indeed.
I think that it's probably true to say that any period of change results in opportunity. And maybe there's an opportunity now to think about some of the things that we've been doing badly or wrongly, or some of the things that have just become stuck can now become unstuck. Things, sacred cows that are in the organization, as a whole. Maybe it's a time that you can move those along a little bit or something. I don't
Yeah.
want to go into exactly what I think they are, but everyone's got their view of what they are. I know
Well,
FDP is a bit
I
of a
could go
target for a
into
lot of people.
I could go into a couple of things that I would like to see. Okay, so this would be my sort of wish list of a new reinvented organization in terms of digital. And I'll constrain myself to digital, but I would really like to see much more emphasis on in-house development, and the NHS as a body of the size it is could have teams and teams of developers that have open source libraries that they produce and publish that other parts of the world will use, because we'll be producing the best open source healthcare stuff. Um,
Mm.
Definitely open sourcing everything, in-house development, and intellectual property obviously retained within the NHS. So absolutely no repetition of previous disasters where we've essentially paid a large organization to build us a piece of software in a bespoke fashion just for the NHS, and then realized only when it's too late that we don't own that piece of software. So we have to change that. And if we did start doing that, we would start seeing the costs for these infrastructural and really important pieces start to go down. And we saw this in practice with the NHS spine. So the spine originally was built by an outsourced company, and then it was rebuilt as Spine 2 by outsourced developer resource, but the intellectual property was retained within the NHS. And suddenly we own our own spine, and the costs went down by 90%. So it ended up costing 10% of the previous cost. That was all handled by NHS Digital and the Digital Delivery Centre, which I had a lot of respect for. They did great work. That's the model we should be following. In-housing this stuff, making it the best in the world not by bluff and bluster and Boris Johnson world-beating announcements, but by actually making it good, actually making it work, actually making it open source and reusable. And we could solve a lot of the problems that each of the individual ICBs are commissioning for by just creating software products that centrally are managed and built, and every ICB can just have them for free, and that suddenly just drives down the cost. So that's the kind of thing I'd like to see. That's a radical culture change. Would take a lot to happen, but you would only need to put in place the right leaders inside whatever digital section emerges inside DHSC. So I don't
Yeah,
know
I
what
mean,
else.
I'd like to see culture change associated with that, and I'm not I'm not a fan of all the kind of buzzwords like culture, and I think they get overused to an extent, because some of the culture gets blamed for a lot of bad software. For example, you get a culture problem if you deliver bad software, naturally. So, but I think that the NHS is very scared, if you like. It's scared of its own shadow when it comes to developing things in many respects. It's become almost taboo, and there's a kind of a feeling that the centre looks down its nose at people a little bit who are developing their own thing. They almost think of you like working in your garden shed and doing it in some amateur way or something,
Yeah.
and they've got, they're like, I won't name any contractors, but they are the big boys involved in this, boys and girls involved in this. We know who they are, and they seem to trust those people a lot more than they'll trust, some extremely competent development functions around the country. I mean, we all use things that have been developed by locals. If you look at programs that have delivered across the country, like Somerset Cancer Registry was developed by the NHS.
Yeah.
So. And I'm not really too fussed like you are about the fact it must be open source, though I agree it's a way of controlling that. But I think the terms of ownership need to be a lot better than
Yeah.
they have been in the past. So, for example, building something like an integration platform, a messaging platform, where you're getting charged per message, to me, is just extortion.
Yeah.
That should not happen. How on earth do we allow ourselves to get into these licensing arrangements with companies that extort the value of their product? And really, if I buy something, yeah, I'm prepared to pay more for it if I'm using it more. But let's think about when enterprise licensing kicks in a bit more and those kind of things. In the
Yeah.
end, you need a contracting authority to look after the software. And I know you can do that with open source, but sometimes it's easier to do it with proprietary software. But if you have a good contract and you understand the terms of the ownership, you shouldn't get ripped off the way that, frankly, the
We often
NHS
do.
has been ripped off in the past, really.
Do you think
So
there's
yeah,
anything
and
in?
I think more local development, should not be frowned upon. I think when it comes to developing any software for complex clinical use, and let's face it, we're not just talking about knocking widgets out over a counter. Oh, we were talking about some really complex functions in clinical, particularly, and you need to be very close to those users to develop that software the way that they will find it works for them, and supports
Yeah.
their workflow and supports the data that they want to collect. The NHS in the past probably still is guilty of building things to collect data. And you've got to, there used to be a saying that you only collect the data as a byproduct of the function of the software. And I
Yeah.
think that principle should hold true. I think that if doctors are sitting there feeling like they're data entry clerks or something, for
Something's
some
gone wrong.
something has gone wrong there,
The
and I know
success of
that
the early
there's a lot
GP
of faith
systems.
being put now in, the ambient voice that's going to get around all of that, but it doesn't change the fact that underlying this, people are a bit too obsessed with collecting records, and the first function of software in the clinical space must be to support the clinical function.
Totally. I mean, the success of GP systems in the early days was because you were just noting down the information that you would normally note down, but now you could do it in a structured digital way. And so you got out of the
Mm.
collateral benefit of just making your normal notes, you were also getting analyzable data. And so it's exactly what you're talking about. It's the idea that, the data was just falling out of your normal activity. There was no extra
But
data entry.
a lot of the systems we use, of course, are American. They're a big market, and you can't ignore the fact that they use their data collection to get paid. So, I mean, we do as well. Don't get me wrong. We know there is a commissioning process and a sort of contracting process, and the data is used ultimately to make the money flow, but not really in the same way. In other words, you don't sell software in this country by telling an organization that it's going to impact their revenue stream, or it's going to increase their revenue stream, or their throughput, or their financial throughput. So
Yeah.
I think that a change of emphasis on clinical functionality, should be there. We should be closer to the users when we're developing software, and to me that probably does mean, I don't know,
Local development,
configuring
yeah.
things closer to the user anyway.
I
One thing I do think about the NHS should definitely own for itself is its data.
completely agree. I think this local development thing is something that the centre has never really grasped. So there have been numerous small projects, local homebrew EPRs, and useful platforms built, but there's no mechanism within the centre, by which I mean sort of NHS England and whatever will replace its functionality, to go and talent spot for those things. So to me, if you see something that's being done in a region that's great, that should be adopted by the centre, given a load of resources, and it accelerated up to the next level. So, because one of the things that stops all these local developments getting out of the hospital that they're in is that the people who've developed them often have very limited resources. They've only got so many developers. What they can't afford to say, look, we've open sourced it, now any trust can also use this thing, because they haven't got the resources to do the support. So for the other trusts to deploy it, implement it.
And there's,
That's
I mean,
where,
you wouldn't, the aversion
yeah,
to using software that's been developed up the road by your local competitor, as people might think of it,
yeah.
it's unbelievable, actually. I've seen this in action, and it is so frustrating. It's just off the scale.
That to
But
me is
of course,
culture that needs to change.
and
Exactly what
we have offered to give things away time and again. We never had a concept of owning intellectual property in our development team. Really, we give it to anybody, but trying to give it away, my God, it's just not worth it in the end. They make your life so difficult. You're trying to give something away, and they'll hit you with a spreadsheet with 500 rows of things that it must do. You think, well, let's talk about how we could develop those things jointly or something. But oh no.
Yeah,
So it's just soul destroying when you even try. And going back to NHSX, of course, one of the things that they had in their core strategy was an NHS ownership of the data, yes, but a clear principle on development was that the data will sit in a platform, and the applications will be interchangeable on that data platform.
yeah,
That the
yeah.
application
Separating the
code
data
would
from
not
the
be
application.
bound. Yeah, would
Yeah,
not be bound to the data, and that was a really fantastic principle to have, and it was probably one of the first things that got thrown in the bin, really.
I think that was always, it was a great thing to want, but because of the way that we procure systems that already exist from large suppliers, you can imagine that they're just not in a mood to be told by one of their customers that they want the entire architecture of the system changed just for that one customer. You can imagine that, Epic or Cerner would just say to you, I'm sorry, but these are the products we have. We're not separating the data from our application for you, because we've already got a market that's 100 times larger worldwide and in the States. It's just not
Yeah, I mean,
feasible.
it's probably a subject of a different discussion, really. It's got nothing to do with NHS England, but the way that we buy things,
Yeah,
we write specifications with thousands of lines in them that are written as if we're developing software. They're like a development spec, but we never actually intend to develop anything because we're out there buying products. And in the
yeah,
end, you're only choosing between 3 or 4 products that work in the area you're in. So your whole specification is pointless because the software does what it does.
yeah. I think the procurement mentality is something that is, that's a potential thing to change. We've got an opportunity now where instead of just procuring everything, which is slow and often results in a very big disparity between what the users wanted and what was possible to commission. And I think we've got an opportunity here. A new broom, DHSC could start to think about doing things differently. So instead of just buying what's out there, which we already know is pretty poor, ask any clinician their opinion of the systems they use, and it will be pretty low in general.
Well,
We
I
have to
mean,
do better than that.
yeah, but of course, one of the inevitable impacts of moving what is left of NHS England more towards a political entity is that any procurement exercise will start to become more politically driven.
Or it
And
could go the other way. Let's look at the positive example of gov.uk. All right. So Francis Maud, senior civil servant, he provided the organisational top cover to allow the government digital team, a GDS team, with Mike Bracken and that whole his entire team, to transform the way that gov.uk looked, and it went from 17,000 different crappy websites to one great big master site where everything looks quite similar. It looks authoritative. It's got small numbers of words. It's got a reading age of 8. It's usable by people. Everything is an action or a transaction that you can do with government, and you can interact with government. That was a transformation that happened between sort of 2005 to 2015. And then sadly, they lost their top cover and they all had to disband essentially. And now they're off being public.digital and doing great things in other countries. But this could be our moment to say we're going to do that with the NHS and say we'll bring all those interactions even more so than what we currently have with the NHS.uk site, but really, really dig in and go further than that, because we've got all that clinical software to rebuild as well. It could be the making. It could be the start of a revolution.
Yeah, so as I said earlier, it's an opportunity. It's an opportunity to do some good stuff, but also, if the far end of that spectrum, if you like, is that health software, the business of health software, gets wrapped up in a trade deal or something.
Yeah. Okay. I mean, that's a dark alternative future. But I agree, entirely possible that the world is starting to change. We've got tariffs, we've got Trump, we've got all that kind of stuff to deal with. And as you say, it could be we'll agree to take Epic for the entire country so that you don't shut down our farming industry or something like that. Yeah.
Yeah, well, others are available, but they are, America's a big player in health software, isn't it? So
It is. Well, I think that's been really interesting sort of roundup, and I think there's going to be a lot more to come out on this NHS England story, and it's been a bit of a shock this week. I think everyone's still reeling from it a little bit, but I'm hopeful that I'm not usually in the position of agreeing with Jeremy Hunt, but cautiously optimistic is how I would describe my view of this. So let's see how it pans out.
It was interesting. Yeah, it was interesting in Parliament, actually, wasn't it? That they weren't exactly throwing rocks at the whole thing over the dispatch box, were they? They seemed to be largely agreeing with the direction.
Yeah. Well, my experience of dealing with NHS England has been that, sadly, despite some great people working there, it as an organisation was not capable of doing anything other than slowing things down. And so I'm quite pleased to see it go, and let's see what comes after it.
Cautiously optimistic.
Yeah. So, well, I think that's a good roundup, and we should probably leave it there. But there will be more to follow, and we'll have some other people to talk to about this situation. So, thank you so much, Ade, for your time. It's been a really good discussion, and I'd love to have you on again to talk about more of the other stuff that we hinted at. The idea of in-house local development and talent spotting that up into the centre and things like that.
Thanks, Marcus.
Thanks, Ade.